We're just going to give one more minute for arrivals. Is this working? Working okay? Sorry, Greg. Thank God for people like you and my whisper voice.
Check 1, 2.
You got a better voice than I do. I'm always known for my whisper voice. Yeah.
We're live on live stream.
Okay. Okay. Okay, we're just going to get started in a minute. We're just going to set up one thing at the front and then we'll get started. Because this is a nursing event, we know that there will be people going in and out because client care comes first. So I know there's family meetings happening, there's care happening, so we'll just work with the come and going of everybody. And thank you so much on this beautiful sunny day. So a warm welcome to everybody, which is in fact today is actually International Nursing Day. How did we do that? And it is my privilege to lead our Nursing Week Accomplishment Tea today. Today we have the opportunity to celebrate and support one another by taking a very much needed moment to acknowledge the strengths, the accomplishments over the past year, and to focus on what's next in leading excellence in care for kids and for families, which is the essence of the core of what we do here. So we're going to spend approximately 90 minutes together to learn, to laugh, and to announce our contest winners, and to provide awards to those who have been exemplary in their nursing practice. So it is with excitement that I bring our commitment. So our commitment from nursing this year is that we're excited to bring clients and families to the heart of everything that we do. We aim to strengthen our partnerships, and that is beyond nursing with our team members, our collaboration, and our communities of practice for the benefit of care. It's been energizing, sometimes a tiny bit tiring, but energizing to have our frontline nurses leading this work, and that's been a huge commitment for us. And our vision is to empower, enhance, and enable ourselves, our colleagues, which means all of our teams, and our clients and our families. So just a very quick pictures of our year in review. You were all here, and for those who weren't, our nursing summit, and some of the commitments we had that day of what we would do, and you can see it happening day by day. This was empowering, enhancing, and enabling ourselves so that we could then create our vision. This was one of our key activities this year around enabling scholarship and our 21 posters. That was very new for us. And then ultimately the vision that we created as 85 people together, and that we're working towards making live and real. We use stories to achieve this, and these are just 4 examples of stories of catching medication errors, being innovative in your practice, appreciating that families are the best part of the job, and how helping families cope and being resilient is just so important. Lastly, we had a nurse practitioner development day where they talked about their contributions. We're a new team here at Holland Bloorview, and nurturing this is critically important. And this is a story about diagnosing and how complex yet gentle and caring that needs to be, and how being with a patient is just so critical in the transitions with care. So also is the Strength Base now renamed the Learning Club. We completed an entire year of going through what I would say is a complex book. And now we're using the principles from that book to apply to complex situations that are encountered in practice. And we're trying to develop, well, we're more than trying, we're doing that, trying to develop core concepts and curriculum around those complex scenarios. And the Nursing Practice Council, I can't say enough about how hard they've worked. This is just in the past year. 12 stories, we have stories at every meeting, 12 standards of care, 8 policies, 6 medical directives, which churns out to 38 accomplishments and contributions, all focused around care. And then our academic accomplishments. And what I'm most proud of here is that we've moved the target on everything. So we have 7 more grants than we had last year, and that's largely because of the tremendous support of the Centers for Leadership. We now have 8 of the 21 projects for the Center for Leadership. Nurses are involved in those, and that is critical because for those who aren't from nursing, we don't have research training in our undergraduate programs. We have research training in our graduate programs, and so for having frontline nurses involved in research through the Centers for Leadership is actually a tremendous opportunity for them to learn more about research prior to grad school. We've increased our publications. We're up by 5 from last year. More presentations, new workshops are new. A shared project with Sick Kids, for which I'm so grateful, is nursing research interns, which we've had 2 this year. Our students, and the red bullet at the bottom, graduate students, that's a new accomplishment for us. We had not had graduate students in advanced practice leadership or in advanced practice. We had had nurse practitioner students in small numbers, but this is actually, I know the number's small, but it's amazing actually for us. So those are some of our key accomplishments this year. Many of you in the room have seen this vision over and over again, but I can't say it enough. And we're working now on 4 strategic priorities. I'm showing you this diagram only to give you a sense. I do not expect you to read it, but to give you a sense of all the projects that are happening within nursing right now. And I've highlighted a few that I think are so important around working and providing advanced knowledge around immunocompromised children, our work with Nathan around narcotics covered, improving how we manage medications, and I wanted to commend our education group around their mentorship program and the clinical coaching program that's coming, as well as planning for another nurse practitioner in the inpatient area. So those are just some key highlights. So then what's next for Holland Bloorview from a nursing perspective? I think we're wanting to very much bring those projects I just spoke about to reality. I think we also want to be better interprofessional partners and collaborators, and we'll work toward that. And we want to continue to improve excellence in care. So with that, I'll hand over to Julia, for those, our President and CEO, to speak for a few minutes before our guest.
Thanks so much, Marilyn, and hello, everybody. It's so wonderful to be here again with you this year to celebrate your accomplishments and celebrate National Nursing Week. Providing quality and safe care is job number 1 at Holland Bloorview, and that's what always will be the top priority. And the reason that we can deliver exceptional care to our kids and their families is because of exceptional nurses like you. The work of nurses is sophisticated, it's advanced and evidence-based, but as you know more than anyone, it's at the same time very human, relational, and emotional. When our families talk about the nursing care they receive at Holland Bloorview, they talk about it as being transformational and life-changing. Last summer, our nurses were interviewed as part of the Best of Nursing. And they shared truly inspiring and powerful experiences with strong themes of passion, excellence, and client and family-centered care. In November, as Marilyn was talking about, we held the first nursing summit with over 85 people participating, including 64 nurses, 2 family leaders, and 19 of our interprofessional team, all coming together to develop a strategic plan for nursing at Holland Bloorview. The outcome of the day was a vision of Holland Bloorview as a widely recognized center for pediatric rehabilitation nursing excellence, not only across this hospital and this province, but across the globe. So we never lack for ambition at Holland Bloorview. We're committed to fostering a culture in which nurses can grow professionally, build on their strengths, engage in learning, be leaders in research initiatives, and excel in their practice. We know that you put your hearts into your profession and on the line for our clients and families, and that you're deeply committed to creating possibilities for kids of all abilities. Through our nursing plan and vision, I promise that we are as committed to you as you are as committed to the kids and families in your care. I'm excited about our nursing team with Marilyn's leadership in fostering a renewed nursing culture that's strengths-based, relationships-based, and evidence-based. And I know all of you will play an incredible role in bringing this to life at Holland Bloorview. I'd like to offer my congratulations to everyone receiving awards and acknowledgements for incredible activities over the course of this year. And thank you again for inviting me to share this special event with you. But most importantly of all, thank you very much for the incredible care you provide to kids and families every day.
So with that, I would I'm so excited about introducing Pam. Pam Hubley is a dear colleague of mine, many years at SickKids, and we have grown up through this system with each other and have deep respect, and both have tremendous passion for strength-based care. So Pam is currently the Vice President of Education and Academic Practice and the Chief of International Nursing at the Hospital for Sick Children, and it's with great pleasure I introduce you as our keynote speaker today to bring more inspiration.
Thank you, Marilyn. She didn't tell you how long we've known each other, but it's been quite a long time. And it really is a wonderful pleasure to be here, to be among colleagues and friends. So I'm hoping in the next few minutes just to share some thoughts around leadership and moving towards becoming a strengths-based organization. I think it's really, really wonderful. And in fact, for me, I find it very inspiring being here, being in this building, being with colleagues, knowing about the work that Marilyn and all of you are doing together. Because transforming care and becoming strengths-based, I think, is our hope for the future, to be really authentic partners with the children and families that we serve. I think becoming is an important word to use in this context because we're not there yet. It's a journey, it's an evolution, and it really is about collaboratively advancing key ideas and concepts that we think are really, really important as foundational to the care that we give. So as Marilyn mentioned, about a year ago, I know the team embarked on a real commitment to embrace strengths-based nursing and began to understand what Lori's work meant to you here in the organization. We had the great opportunity together, Marilyn and I, to think about hosting a symposium, which we did down at SickKids, but in collaboration together as organizations and in partnership with the International Institute for Strengths-Based Nursing. And it was the first time in Ontario that this work was really brought and celebrated and talked about in our community. So I want you to feel really proud of the work of your team, the leadership that you're showing, because it's not only here at Holland Bloorview, but it's in Ontario. And I'm sure Marilyn's somewhat humble, but I know many people are looking to her and looking to us at SickKids for our experience in this area. And I think that you're going to be in a great position to be the forefront of really transformational work that's going to actually help us all learn how to be different with patients and families. So we've started this journey together. Holland Bloorview has made this huge commitment, and I love the fact that you had the summit and that you had the strategic plan. And every time I come here, I learn something new, and I'm seeing a new image today, so I'm going to go up and look at that afterwards, because I think so much of the work here is just so exciting. But we know in nursing that we can't do this alone. that going on the journey to becoming something new and different requires the team. Many of you in the room come from different disciplines. You have different responsibilities and accountabilities to patients that you serve, whether it be in leadership, research, from different disciplines, education. All of these insights, thoughts, perspectives are really important to us as nurses because we know we can shape our thinking to the best of our ability because of our relationships with different people. If we do this alone, we're going to miss something. We're not going to be able to actually optimize what strengths-based really means. So it's really important that we acknowledge that this is a team effort. One of the things that we've talked about in nursing for many years is that nursing is a little bit like an iceberg. There's the big part that you see on top that's visible, the work that can be observed, but the majority of the work that gets done is often invisible. It's not seen by a lot of people, and there's a lot that could go missing when you think about nursing if you actually don't take into account both the visible and the invisible work. One of the wonderful things about strengths-based is actually pushing us to raise up that invisible work, to label it, to put a name on it, and to be much more conscious of what we're doing, how we're doing it, and what the intended outcome of our interventions, of our interactions are. So I love icebergs. I think they're just so beautiful, but they also are a great image for me to remind me not only of the work that we see every day, but the work that we need to do underground to help raise up and be visible to others. So one of the things Marilyn asked me to talk about was change. And I know as a leader, there's opportunities to think about change in a variety of different ways. And usually we go to the literature and we try to find out, what's a model? What's going to help us get to the new place we want to be at? And one of the models that's often used is Cotter's 8-step model. And I put this up here because no doubt Marilyn's had some thoughts about this, and she's working towards her leadership and building the team to address all of these different states you see in the model here. But one of the things I find with these leadership models is they often are very linear. They sort of outline what appears to be a very easy process to get from where you are to where you want to be. And in fact, it's not really like that. Really, big organizational change is messy. And it's not that easy, as thoughtful and as planful as we can be. There's always some things that come up that just aren't the way we expected them to be, that cause us to reflect and change our course of direction. And personally, I kind of like that, because I think, and of course we're looking after children, so it's always great to have these kids' images, because the messiness invites us to be creative. It invites us to think about tapping in to our emotions, to our creative energy, and to think about how to resolve problems and create the path forward together in maybe new and different ways that we wouldn't have thought about if we were just sitting planning at the desk. So I wanted to share with you that as a leader, as someone who loves change and who thinks about change and implements change, it's really important to think about the models that guide you, but it's also really important to be open to the creativity and the continuous looping back and forth and the messiness of change. So I just took this from Marilyn's slide deck that she generously shared with me, because one of the things I noticed and I wanted to commend everybody on was that this great strategic plan that has been set in motion is really creating that visibility for nursing, and it's creating the visibility for strengths-based. It's on your website, it's in the language that you're using, it's in images, it's in the wonderful work of the book club that Marilyn talked about, and it's in the wonderful work of the videos that I saw that are absolutely fun, engaging, and help translate really big concepts into practical applications. So I just wanted to congratulate you on this great effort. The value of strengths-based, I think, really lies at the heart of what strengths-based nursing is. And it's really about what are the values and what are the approaches that we want to embark on and embrace. So this is probably not new to some of you. It might be new to a few, but really this is the value wheel that underpins the strengths-based movement. And what I think is important as part of the journey to becoming strengths-based is to begin to unpack, what do all these concepts mean? How do they apply to us as individuals? How do we change our systems to make sure that we're in fact creating that healthy, healing environment, attending to the uniqueness of each person that we're serving, understanding the subjective reality, the created meaning that the individual holds when they come talk to us about their particular situation. So we can talk about strengths-based in a very academic and cognitive way, but our challenge is going to be translating that to the practicality of day-to-day work. One of the ways I think that change leaders really do this well is talk about the why. This is not my idea. This is work from Sinnott, and he talks a lot about leading change is about sharing the why and starting with the why. It's not about sharing the plan. It's not about sharing the absolute end goal. It's really about creating energy and passion for people to understand, why is this so important to you? Why is strengths-based nursing important? Why should we care about it? Why should we be putting energy into it? So I challenge everybody to think about, how do you answer this question? How do you share with your colleagues why strengths-based nursing is an important journey for Holland Bloorview to be on? A few ideas that I have, and these are ideas in collaboration with Lori Gottlieb, the author of the Strengths-Based Nursing book, are in answer to the why. And it's because for patients and families foremost, we're really interested collectively at improving the quality of life, improving health and healing opportunities, developing better respect and partnership, creating empowered relationships, improving our communication and our connectedness to the system, and creating a safer system for everyone that involves perspectives from parents, families, and patients themselves. For nurses, strengths-based nursing will help us achieve our full scope of practice and make better use of the education that we have and the skill sets that we bring to the table. Strengths-based nursing will help us become empowered as individuals and be advocates for the children and families we serve. I also think it has a really important role in helping us with our professional identity, in feeling pride in what we do, and actually being able, as I said in the beginning, to talk more explicitly about nursing practice. I think it offers opportunities for greater opportunity, more engagement and joy in work, which leads to less burnout, and obviously better retention. For the system, strengths-based nursing offers opportunities for improving effectiveness, efficiency, and economical care. It gives us the chance to really talk about patient outcomes, to be focused intentionally on the interventions that we make to work towards achieving the outcomes that are evidence-based and the ones that we really want to help our patients get to. We think that there's also opportunity in the big system for the retention of nurses. There's a lot of discussion about the challenges, the workloads, the intensity of nursing care. If we don't collectively find ways to express our enjoyment, our satisfaction, our enthusiasm, our commitment and renewed energy to nursing, we really have collectively, I think, at risk the loss of many nurses from the profession. I think strengths-based can help us reframe collectively what's important and where we need to be spending our time and attention. I think that in turn will help the system understand what is the valuable resource of nursing and where are nurses needed to make a difference in the care of patients, families, clients. And hopefully, strengths-based will also help the system become more responsive to the client, the patient perspective. And it will help us shift from the provider-driven to the client-centered way. So what if? What if Holland Bloorview is the epicenter of strengths-based nursing? I just thought about that when I was presenting, or when I was thinking about this. I thought, oh my gosh, like there is so much opportunity for this organization to be the place to go. And so I just challenge you, what if? Imagine that, dream big, think about what would have to be in place for other people around Toronto, around Ontario, around Canada, around the world to be saying, I want to go to Holland Bloorview, I want to see what they're doing, I want to understand how those nurses are delivering the care that gets those outcomes and actually helps them enjoy what they're doing and is part of a whole movement that is transforming the way we give care. I think it's possible, and I think you're absolutely on your way. So I just put this one up here because I don't think anything is possible. And I know that's a big mantra at Holland Bloorview, and possibilities is one of the big concepts that drives everything you do. And I just encourage everybody to embrace that every day. It's only when we don't believe it's possible that we actually stop ourselves and restrict ourselves from actually achieving what really might be. So how do we change? I think a big part of changing is about being a leader. So cute, eh? And being a leader requires you every day to show up in a way that is also strengths-based, that is intentional, that is about thinking through, how can I do something different that's going to shape the system to be the way that I want it to be? And one of the real dangers when we talk about leadership is that people think that they're not the leader, that they can't be the leader, that leaders are born, they're not made. And this is an old quote, but it's one that I kind of hold dear to my heart because I think it's really true, that the myth is that leaders are born. And it's not true. We can all be leaders. So one of the ways we can be leaders is taking stock of ourselves and thinking about what are the things that we need to change within ourselves to actually help improve the care that we're delivering, the way that we're interacting. And I really love this model. It's an old model, the trans-theoretical model of change. It's been around for about 20 years. It's been well studied as a model for behavior change. And I just put it up here, not because I want to get deeply into the academic literature, but just as a way of me sharing a model that's really been helpful around how I think about change in myself, change in my colleagues, and change in the bigger picture. So pre-contemplation is the stage where you're not even thinking about what you want to happen or the change that would be. So you're not even thinking about, strengths-based nursing. You're just it's not even on the radar. Contemplation is the time and space where you start thinking about, hey, that's kind of cool. I'd heard about that book. I'd like to learn more. And preparation is kind of the place when you start thinking about, I understand the concepts, I have some knowledge, I think I'd actually like to do something different, and you begin some planning. And action obviously speaks for itself. It's the just do it phase. And the maintenance phase is really about figuring out how do you actually keep that behavior change that you have made in place and going. So I'm not going to go into lots of details, but Marilyn just asked me to share a few sort of tips and tools and ways of thinking that I use when I'm thinking about change, and this is one of them. But then once you've changed, yourself, and you've gone through that, and you're feeling really good, and you're thinking, I know how to do this, and you know what? I am not the problem. It's not me. It's you. And if it's not you, it's the big system. Well, that's kind of true. Sometimes it's the system, but a lot of change starts with ourselves, and it's really important to have that stance. When we think about it's you, it's the system, then we have to start thinking about, okay, well, what is it in the things that we're doing, the processes, the structures, the ways we're working that needs to change? Because if we want things to be different, we can't just keep doing the same thing over and over. So one of the ways I think about big system change is through also a very simple model called ADKAR. It's about awareness, desire, knowledge, ability, and reinforcement. And it's similar to the Prochaska model. It's just a different group of researchers, a different approach that's been used. But I find this framework really, really simple when thinking about how to help people move from one place to the new place. So this maybe will help you, Marilyn, in thinking with your team about how do we build awareness, how do we understand whether people have the desire to change, what do we need to do to actually help people have the actual knowledge to change, do they have the ability, and what do we need to put in place to help them get the ability to change, and what system things do we need to change? Do we need to change documentation? Do we need to change the way we do rounds? Do we need to change the conversation that we have at handover? Do we need to actually do some things differently? So I found this model quite helpful. And just as I wrap up, I'll comment on a couple of other things I find important. And one of the concepts is resilience. When you're going through change, you have to take care of yourself. You have to find that way of continuing to grow despite the change and the shifting ground. I found this picture a while ago. It wasn't in relation to this talk, but I didn't know what to do with it. And so I thought, I'm going to use it here because I think our resilience can come so much from the inspiration that we have from the families and the children that we work with every single day. I probably don't need to tell you that. You're probably here because that fuels you and motivates you. But when you look and you see what people can accomplish when they have faced great adversity and they've had to make significant changes in their life, making a change to a documentation system, thinking about using different words when we interact with families, I mean, those are simple, simple things. So we should be able to do them. This is another model that I really like, and I think on a simple day-to-day basis, you can ask yourself, if you're a leader of change and you're championing the movement to becoming strengths-based, you can ask yourself every single day these 5 principles of leadership, or 5 practices. Was there something in your day that allowed you to challenge the process? Did you ask a question? Did you raise a perspective that might offer a new way of thinking about something? Did you inspire a shared vision? Did you tell your story in a way that helped someone understand about the importance of strengths-based? Did you enable others to act? Was there something that you did that helped empower and let them do what was important to them? Did you model the way? Were you a good role model as far as your strengths-based nursing goes? And did you encourage the heart? Did you tap into that emotional connection, the way that really inspires people to begin to think about something differently and then be rewarded for that change? So lots of good things happening in this environment. I have no doubt strengths-based will continue to evolve and develop. As a leader, I think you need to identify yourself as strengths-based leaders, hold your head high on that, and begin to share your stories, not only here at Holland Bloorview, but with other pediatric nurses and with other providers across the province. Who we are as leaders is shaped by our networks. It's shaped by those people around us. So pay attention to that. Don't keep your story inside. Share it big and wide. And I think that, you know, again, another quote that's really inspirational to me is from Margaret Mead. And there are big changes that can happen by small groups of people who put themselves together and are passionate to achieve their goals. No doubt that a small group of thoughtful, committed citizens can change the world. Indeed, that's all that ever has. I just find that one really resonates with me. And you have to believe, as we talked about, in those possibilities. You have to believe in what you want to be, who you want to be, to make it happen. Gandhi is certainly an inspiration to many, and these words, I think, also help. So great things are accomplished by talented people who believe they will accomplish them. I think everyone in this room fits that bill. So everyday actions at Holland Bloorview will relate to the plan you have to advance care, teaching, learning, and research. I'm sure through your creativity, you will come up with even more tactics and practical approaches to embedding strengths-based nursing. The last thing I'll say is that not only do you want to bring yourself to the table and be a leader in this change, but you need to ask yourself, who can you bring with you? Who maybe doesn't believe so much that you can bring along this journey and help them understand and embed strengths-based into the work that they're doing. So I'll leave you with that, and I hope that your journey around strengths-based continues to inspire you and bring wonderful, wonderful outcomes to the patients, to the families, to the clients that you serve.
Thank you so much, Pam. And we definitely are at the contemplation phase. So it's just so inspiring to have those suggestions to bring us forward. And I see nods in the audience. In our commitment towards strength-based care and in supporting our accountability around if we have opportunities for development, we want to bring that back. And so with that spirit in mind, Shawna has graciously agreed to come back and talk about a conference that she attended, actually a 2.5-day meeting on informatics. And she's sharing a different kind of story that will take us to a different emotional place. But it'll help us think about the tremendous improvements and opportunities that we have in all the different ways that care is provided for all of us. So with that, Shawna.
Hello, good afternoon, everyone. I'd like to thank Marilyn for inviting me to speak today. I'll be talking on considering human factors. And as Marilyn mentioned, this presentation was inspired by a presentation given at the 4th National Institute on Nursing Informatics by Patricia Trobovich, which I was fortunate to attend. And of all the information that was shared over that 2.5-day institute, I found this topic to be the most inspiring and captivating because as much as technology in healthcare advances, it's still very much a healthcare setting, that sector that is dependent upon the skills and knowledge of human beings. So to start off, what are human factors? It is the study of how people interact physically and psychologically with products, tools, processes, and procedures. It's also working to make the environment strong and function in a way that seems natural and healthy for providers. So I'd like to share a story, Denise's story, a story from the Edmonton's Cross Cancer Institute. And although this story is from 2006, it was the inspiration and catalyst for many positive changes in patient safety and still resonates 10 years later. Denise Melanson was a 43-year-old teacher's assistant who was being treated for cancer of her nasal passage at Edmonton's Cross Cancer Institute. She was being treated in a busy outpatient area. She was sent there to have her ambulatory care chemotherapy infusion started, was started by the nurse, and sent home with the instructions to return 4 days later when the infusion would be complete. Unfortunately, the nurse in programming the pump did not put in the right rate, and the infusion finished in 4 hours rather than 4 days. When Denise realized that the infusion had finished too quickly, she returned to the institute, but at that point it was too late and the effects were fatal. She died 22 days later. So this, you can see, is the physician's order, shows the drug that was to be given, the amount to be given, and that it was to be given over 4 days. This is the drug label, so the drug itself was prepared in-house by the pharmacy there at the institute. There's multiple pieces of information on this label. It's a very busy label to read, and you can see how it would be easy to pick up the wrong piece of information from it. The pump at that time was an ambulatory pump. It was not a smart pump at that time, so we've made improvements with that, and now have smart pumps whereby safety checks and limits will ensure that drugs are delivered at safe rates. The calculation itself was a multi-step calculation. At the time, the drug that was to be delivered was not required to have an independent double check, and the nurse herself took it upon herself to have another nurse check her work. However, the second nurse did not catch the error. So when the Institute looked at the incident itself, they found there were multiple factors that came into play. First off, the drug label being confusing, critical information not being prominently displayed. The order itself did not include pump programming values. The pump procedure was a multiple-step process to program and did not provide safeguards, feedback safeguards. The double-check process itself failed. As well, it was a busy ambulatory care unit that the nurse was working in, and the nurse was required to complete multiple activities simultaneously. The nurse was floating on this unit from another another unit where the pumps were configured differently, and it was more familiar with the home unit procedure. And system awareness. When they looked into the incident, they had found that there were 7 other incidences with this particular drug where a similar outcome had happened, and the Institute was not aware of them at the time. So what happened after the incident? The staff involved took a leave of absence. The staff were eventually cleared of wrongdoing and returned to work. And nurses themselves working in that unit recognized how easily they could have made the same mistake. The family remained on good terms with the staff at the Cross Cancer Institute. The incident was disclosed to the public, and Tony Fields, who was the director of the Cross Cancer Institute at the time, said that public disclosure, in retrospect, is definitely the right thing to do and aligns with the organization's values of respect, accountability, transparency, and engagement. An investigation was launched and completed by the Safe Medication Practices Institute for Safe Medication Practices Canada, and there was a bursary created in Denise's name. The Denise Melanson Bursary is an educational award for healthcare providers for educational opportunities related to patient safety. And this incident itself, they saw an increase in unsolicited donations to the hospital. And this incident itself propelled Cancer Care Alberta to implement strategies to achieve better healthcare and safer healthcare across all their care settings. So the Institute for Safe Medication Practices Canada found 3 main factors that contributed to Denise's death, those being the overdose itself, the design of the chemotherapy protocol. It was questioned why a fatal dose was given to the patient in a single bag, and also the inability to mitigate the fatal dose once it had been administered. This is a quote from Dr. Lucien Leap, who's a professor at the Harvard School of Public Health. He said that the single greatest impediment to error prevention in the medical industry is that we punish people for making mistakes. So as healthcare providers, we know that everyone comes to work intending to do good, and many errors are the result of bad system design or bad organizational structure, rather than irresponsible action of the person themselves. And oftentimes you'll see that training and education for staff is implemented as a solution when incidents like this happen, but training and education are Band-Aid solutions for poor design. So this is a chart put out by the Institute for Safe Medication Practices Canada, looking at the hierarchy of effectiveness for strategies for patient safety issues. You'll see the bottom 3 are person-oriented approaches, those being training and education, rules and policies, reminders, checklists, and double checks. And the top 3 being the more effective solutions would be design-oriented approaches, such as simplification and standardization, automation and computerization, forcing functions, and constraints. So overall, things to think about. Errors are an opportunity for learning and improvements in care. Transparent disclosure is important for maintaining accountability and ensures client and family trust. And systems design should consider human factors. Design to intentionally direct users' attention to the most useful and critical functions and features and build on our strengths. So as care providers, we have an opportunity to learn from past incidents and implement positive changes to lead the system so that it functions in a way that is healthy for both clients and families as well as care providers. Thank you.
That was excellent, and it speaks to the iceberg. Because a lot of what you talked about is the invisible part of care that is not articulated, and I think we're all so committed in this room to the safety. So any opportunity to learn from stories from the past and our current stories is just so beneficial. And I thank you for bravely being a leader and presenting today, Shawna. Thank you so much. So our next item on the agenda is Kimberly Siu-Chong, who wanted to share a story today. Please, Kim.
So happy Nursing Week, everyone. One of the best parts of my role as Client and Family Relations Facilitator is that I get to issue Spotlight Awards from our clients and families. I have the privilege of reading every single one of those heartfelt letters of recognition for our nurses. And so I know for a fact that this room is filled with client and family-centered care champions. The important work you do is making a profound difference in the lives of our kids and their families. And I'm here today to share a story about that impact. But first, a little background. I volunteer with the Children's Aid Foundation, and they partner every year with a program called the Corsage Project. Just briefly, about 300 young women graduating from high school who experience financial hardship to the extent that prom would be unaffordable are chosen to participate in the boutique ball. At this event, they get the whole prom shopping experience: new dress, shoes, purse, jewelry, a mini makeover, all free of charge. However, this day is about so much more than formal wear. These young women are celebrating a hard-earned rite of passage with their friends, and they have such hope and excitement about their futures. Many girls share that this experience marks the first time in their lives that they've ever felt worthy. Back in April of this year, I volunteered as a personal shopper, and I was randomly paired with a young woman who came with her mother. After finding her dream dress, I asked her about her plans for after high school. She said to me that she wanted to become a pediatric nurse. When I told her that I worked at a pediatric hospital called Holland Bloorview, she gave me this quiet, shy smile and said, "I was there." She then shared with me that she had a stroke and she was an inpatient client on our BERT unit for close to 2 months. And it's her hope that one day she can come back to us as a nurse. When her mom found out that I worked at Holland Bloorview, she gave me the biggest hug and kiss. She didn't say much, but with tears in her eyes, she simply just said, "Thank you." I think seeing your daughter in her prom dress can be pretty emotional, but I could just imagine what their family must have been through during their rehab journey. And so to be on the other side of that experience, seeing her child so beautiful, so happy, and absolutely thriving, I mean, that's another level of emotion. And I felt like in that moment, her heartfelt gratitude was totally meant for her healthcare team and the excellent care you gave her daughter when she needed it most. Now, even though I'm not a clinician, on that day, I had the honor of catching a glimpse of your tremendous light just by association, and I felt so genuinely proud to be a part of Holland Bloorview. Not only did you play an instrumental role in this young woman's physical recovery, but to me this story is about healing and hope. The kind and compassionate care you modeled touched her life, sparked a dream, and actually inspired her vocational calling. She looked at her nursing team and she said to herself, "That's who I want to be when I grow up." That's a pretty powerful ripple effect you've had on this young woman's life. And I'm just telling you one story. There are countless others out there. So the impact our nursing team has had, is having, and will have on our clients is both immeasurable and so invaluable. I just wanted to close with a quote from an article entitled "Somewhere There's a Nurse," written by a nurse named Medina. All around us are nurses, silent superheroes who do and see the unimaginable. Some of it is amazing, so incredible that it would bring tears to your eyes, and some of it so horrifying that just thinking about it brings intense pain, even to the most seasoned of nurses. The best part of it all is that we have the ability to change lives every single day. Our job can be thankless, but it can also be beautiful and consuming. The kind of consuming that changes who you are, makes you cherish the sunshine, and gives you the strength to be a better person, a better nurse, one patient at a time. It's what we do. Happy Nurses Week to the most complex and amazing individuals on this earth. Thank you.
Okay, so everybody in the front row is crying. I can't see past the front row. But actually, Kimberly, You really got me with the even the most seasoned. And so now the next part. Our clowns.
Hello, my dear friend. Wow, that's really loud. You know, it's our pleasure to be here and our honor as a clown flight doctor and as a butterfly trainer nurse. We're extremely excited to be among you excellent folks here to celebrate you. And funnily enough, we just happen to have a song for you, my good friends. If you have a boo-boo or perhaps a leak, if excellent care is what you seek, well, you'll be on the winning streak with nurses, Happy Nurses Week. Oh, if you need a wound change or some helpful meds, if you need a transfer back into your beds, because frontline care is clearly being led by nurses, Happy Nurses Week. Shobity-bobity-doo, take it! The song now, everybody. Here we go. If you have a boo-boo or perhaps a leak, if excellent care is what you'll be on a winning with nurses, Happy Nurses Week. Shobity-bobity-doo. Whoa! If you need a wound change or some helpful, if you need a transfer back into your, because frontline care is clearly being led by nurses, Happy Nurses Week. Thank you, everybody.
Okay, so now that we've taken on the emotional ride, I'm accused of that at home. I can take people from tears to laughter in inappropriate seconds. So as some of you know, probably in a sleep-deprived state, I decided that it would be a really cool idea to have a strength-based nursing care contest. And so our next item on the list prior to our awardees is to announce our strength-based nursing care contest winners. Whoops, still can't see. So our first prize, and I actually don't know if, well, they aren't really in order of priority of first, second, third. We play equals. So one of our top 3 prize winners is a poster that was created by Jeanette Schoon that's actually here to our left. And what's so creative of it is that she has managed to create terms that all start with C that will enact and enable strength-based care. And so it's not just specific to nursing, it's for all of us here in the room. And I just commend her tremendously on her creativity. Is Jeanette here? No. So the prize winners get a $100 gift certificate to whatever they want. Our next prize winner Caitlin, I hope I get this right, is Dilshad, and what, it was a partnership, was it? Dilshad, this is a Wordle that Dilshad put together around strength-based words, which I thought was inspiring and would keep me honest in my office as I'm working each day. So Dilshad, please come forward. Congratulations. And our third winner is, this will just happen. I have to hit play. Really, how will I do that? Our third is actually a video. So we actually had 6 entrants into the competition. Oh yeah, like I still can't see from crying. And this is by Aaron Burrell, who put together with, it has no sound. It's our first run, but it's a video on the values that Pam spoke to earlier. With our clowns. We have some editing still to do, not to worry. And the strength-based values are what we do every day and that we're working towards. So those are our contest winners. And I also wanted to say that some of these contest entrants came in the middle of the night. So people were working through the night or late into the night. And we have 3 others that we'll share on the Nursing Viewfinder website. We'll have all of those on our website. But those are our winners. Now for accomplishments, I wanted to recognize and honor 10 nurses who have accomplished and demonstrated a commitment to lifelong learning, which ultimately we know improves the care for children and families. So today, each of these recipients went out, took a risk, and made their goals happen. So with that, I would ask each of the 10 people to come forward, please. Victoria Chen for doing the National Rehabilitation Nursing Certification. Anna DeMambro, Michelle Balcarin, Irene Simpson, and Marianne Fallon, who took the Dorothy Weiler Leadership Program and received their certificate for the completion of that program. So please come forward. Karen Gann, for the Certificate of Registration through the College of Registered Psychotherapists of Ontario and a breathtaking 6 new publications. Yeah. Karen Fabris Silva and Adam Wassler for bravely going back to school after having achieving their RPN, going back to do their Bachelor of Science in Nursing. I commend you. That's a hard thing to do. And Andrea Lozon for the AstraZeneca Award for Innovation in Chronic Disease Management. And lastly, Kathy Maxwell, who also isn't here, but for her Infection Prevention and Control certification, recertification. So, of those names, are any of those people here? Please come forward. We'll get a photo of that group because we have some anxious awards coming forward next. So importantly at this point, we've had a nursing award of excellence in the past, but the applications this year were just so excellent that I can't even get through this. that we actually came up with 3 Nursing Excellence Awards this year because the applications were just tremendous. And so we had Randy Dindal, who has worked a night shift last night. And Randy worked nights last night, has slept a wee little bit, and has come back and will actually come again to work nights tonight. So that's like amazing, Randy. I would ask the 2 Kelly and her colleague Trish, I would ask that you please come forward with Randy and read your nomination letters that were so...
Great. So, yes. Do you spot the difference? We're actually just testing out a new therapy uniform, so we'll ask your feedback after we honor Randy. Not
purely coincidental. And it crossed my mind this morning, too, as I was looking in the mirror. And I don't... Anyway, so it is with great pleasure that I write this letter to support my nomination of Randy for the Nursing Award of Excellence. I believe that Randy's nursing practice exemplifies the values identified as essential to receive this award. As a physiotherapist who has worked closely with Randy for his entire 14-year career at Holland Bloorview, I feel I'm in an excellent position to identify him as a nurse truly worthy of this award. Client and family-centered care is one of Holland Bloorview's core values. Client and family-centered care involves ensuring that parents have ultimate control over decision-making, treating parents respectfully and supportively, and providing parents with needed information. Randy easily embraces and exemplifies this value by virtue of his personality. If you were to ask any team member to describe Randy in a few words, they would say he is warm, compassionate, and gentle. Families in particular are reassured and comforted by his gentle and caring manner. To highlight how appreciated Randy is on the team, this year he received 8 Spotlight Awards from families. A particularly poignant comment from one family member really identifies his strengths, and I quote, "Thank you for all of your wonderful care and compassion. I know I wasn't the most cooperative patient and probably your most frequent call bell ringer. Thank you so much for your patience and understanding. Thank you for being there when I was in pain, afraid, and sad. Special thanks for comforting me, listening, and making me smile." Randy consistently demonstrates client and family-centered care through all of his interactions with clients, families, and colleagues. Nursing attendance at family meetings can often be a challenge due to scheduling conflicts. However, Randy consistently attends family meetings whenever he can. He presents valuable information to parents about their child in a respectful, empathetic, and warm manner. He understands the significance of his presence at these important meetings between client, family, and team, where relevant information is provided, and he is able to visibly demonstrate his role as an integral member of the team. He has a strong interest in ensuring that we all work in a safe environment. He readily shares his concerns and suggestions for improvement with his manager. Because of his interest in safety, Randy recently joined the Healthy Workplace Committee. In line with his concerns about safety, Randy can also be viewed throughout the centre on posters endorsing the flu vaccine. A new project on the inpatient unit is the PODS initiative, which involves ensuring parents are provided with comprehensive information at discharge to ensure a smooth transition home. Randy has embraced this initiative and is working closely with the other nursing leads to ensure his families receive accurate and timely information. In recognition of his outstanding work on BERT, in particular around the PODS initiative, he received a High Five Award from his colleagues. He's an active participant in the nursing student program. He is frequently a preceptor and receives very positive feedback from his students. He also values the need for ongoing education and takes additional courses to further develop his knowledge whenever suitable opportunities arise. In the fall of 2015, he attended Nursing Symposium on Strengthening Nursing Environments. Staff members who consistently work together are essential to creating an effective team that can provide exemplary care. Randy is an outstanding team member who appreciates the vital role that he plays in the care of the client and their family. If I need to teach nursing staff a particular intervention with a client that Randy is caring for, I can count on Randy to enthusiastically participate and help me encourage other nurses to join the training session. He makes himself available as he understands that we can only provide the best care for our clients when we work together. I cannot recall a time when Randy indicated that he was too busy to join me in an education session, even if it wasn't a client that he worked with often. He values teamwork and supporting his colleagues. Randy's nursing colleagues hold him in high regard and thoroughly enjoy working with him. As one nurse said to me, quote, "If I ever need help, Randy is the first one up and asking what he can do to help, even if it means putting my work ahead of his." Comments like this truly indicate an individual who values working in partnership with his colleagues and supporting nursing practice. Of note, a few years ago, Randy and I were involved in a situation with a client that could have resulted in significant conflict between us. While the details of the incident have long faded from my memory, what I remember is the professionalism, honesty, integrity, and lack of defensiveness that Randy displayed throughout our conversations. My respect for him as a person, colleague, and professional nurse further developed from this experience. My career as a physiotherapist has spanned over 35 years, and I've always worked on nursing teams. I believe I am able to identify outstanding nurses who demonstrate a high level of caring, respect, and commitment to client and family-centered care, and who value and model collaborative teamwork. Without a doubt, I can verify that Randy understands how each member of the team plays a vital role in the care of their patient. No one profession is more important than another. For the client to achieve their optimum, every team member must work together. Randy values his contribution to the team and knows that for his work to be most successful, he needs to work in partnership with the clients, their families, and other team members. Randy models exceptional nursing practice on a daily basis. Holland Bloorview is truly fortunate to have a nurse like Randy on staff.
Okay, so I thought mine was long. But I cut some down. So I am very honored to take this opportunity to nominate Randy Denial to receive the Nursing Award of Excellence at Holland Kids Bloorview. Randy has been a highly respected and valued nurse at Holland Bloorview for over 14 years. Randy once remarked that he had never held a baby before he started his employment at the Bloorview site. But you would never know this when observing his comfort and ease when interacting with clients of all ages. In my role as an occupational therapist, I work closely with Randy at the center. Randy combines his open and friendly demeanor with professionalism. He regularly greets coworkers with a warm smile and a welcoming hello. When Randy observes staff looking lost or perplexed, without hesitation, he can be heard saying, "How can I help you?" Though the demands on the nursing staff at times are overwhelming, Randy is there to provide assistance to fellow team members in his characteristic calm and gracious manner. His natural way of supporting his peers is evident in all areas of his nursing practice. Randy is an excellent example of a team player who serves as a role model to new and seasoned staff. He is approachable, resourceful, and respected by his fellow members. Randy exemplifies many of the core values of our facility. He is often the first contact for clients and their families upon entering the hospital and instills a sense of confidence in families through his comforting and caring nature, excellent communication skills, and clinical abilities. Randy has helped many clients and families cope with the uncertainty of transitioning to a new facility, new faces, and routines, as well as coping with the illness that resulted in their hospitalization. He is respectful of the needs of the client and their family while also guiding them through the rehabilitation process to maximize the child or youth's potential to participate in all activities. There have been many times when clients and families have struggled with aspects of the rehabilitation process, and Randy has handled these situations with diplomacy and honesty so that the family felt their voice had been heard and an acceptable resolution was achieved. Holland Bloorview has made a commitment to providing client and family-centered care. Randy has woven this value so finely into his daily care that is inherent in his nursing practice. Clients and families, as well as fellow team members, have recognized his client-centered approach and honored Randy with numerous spotlight awards. Randy ensures that the client and family are active participants on the rehab team. He listens to and engages the family in decisions around intervention and to support them to develop the necessary skills to take control of aspects of care, maybe managing G-tubes or administering medication. Randy patiently works with the family to help them develop confidence in their abilities to care for their child. He also manages with his demanding schedule to ensure that he attends the regular family team goal plan meetings, as Kelly said, to share updates and to work with team to provide coordinated family care, center care. Randy is committed to ongoing education and attends relevant in-services, conferences, such as the Sick Kids Nursing Symposium, and rounds as his schedule permits. Randy also demonstrates his motivation to learn by engaging in discussions with staff around new interventions or potential equipment being introduced in order to develop his knowledge base and ultimately provide better care. Conversely, Randy will readily share his knowledge and observations with staff to ultimately support the client care. Randy has been a preceptor to numerous nursing students and consistently receives positive feedback from all his students. Randy has also been involved in many workplace safety initiatives in the center. He was involved to launch the PODS initiative to ensure the families had the most recent and pertinent care information upon discharge. Randy also visibly demonstrated his commitment to a safe workplace environment to staff, clients, and visitors by being the poster child for the flu vaccine this year. To conclude, I feel that Randy is well deserving this award, and it would be wonderful to see him recognized for all his contributions to Holland Bloorview Kids Rehab, including the countless above and beyond acts he quietly performs.
Congratulations. And a photo, please. Oh, really?
I know.
Sorry, I have to take one also, so you guys are just take two.
Thank you so much for such an excellent example of how team and team working together is just critical. Our second nominee is Excellence in Advanced Practice Nursing, our nurse practitioner, Ritu. And the nominees, please come forward for that. That would be Pam, and I'm reading for Sean.
Good afternoon.
Ritu, please come forward.
Oh, she's going to stand for the whole thing?
Okay.
Okay. Thank you, everyone. This nomination was done by myself, Elaine Widget, and Dr. Rumney. I'm going to read a little bit from our letter that Elaine and I put together. Ritu is a stellar nurse practitioner on the brain injury rehab team, and she provides exceptional, skilled, and compassionate care for clients with an acquired brain injury. She has a keen understanding of the family's journey that they embark on and is always sensitive and empathetic to their needs. In many instances, her clients are very complex with high medical, physical, and psychosocial needs. Ritu considers all aspects of the client's care to facilitate optimal recovery and support the transition home. In doing so, she collaborates with many stakeholders and community partners to ensure her client's success. Her dedication to clients and families is impressive. On more than one occasion, I have seen her painstakingly walk alongside a mother as she attempted to calm an agitated child, helping them every step of the way to understand and cope. In these moments, families are highly stressed and it would be easy for them to lose hope. But Ritu's calm and reassuring approach keeps them focused on their child's strengths. Ritu also helps families navigate systems that don't necessarily communicate with each other, ensuring that resources are in place to support our families. Over the past 4 years, Ritu's leadership skills have been invaluable. She actively participates in a number of initiatives that promote excellence in nursing on individual and team levels. She is always available to teach and mentor nurses on the floor. She has been instrumental in the success of our weekly rounds for nurses. Through the Center for Leadership in ABI, Ritu has received funding to develop a clinical pathway for clients with anti-NMDA. This has involved a retrospective chart review and family staff focus groups, and Ritu presented this work at the International Brain Injury Association in Liverpool, England this past year. Ritu is also active in representing the nurse practitioner team on both Nursing Practice Council and the TASAN Nurse Practitioner Working Group, organizing and hosting a meeting of the NP representatives from hospitals across the city. She has been a dedicated member of the planning and implementation group for the Best of Nursing and Nursing Summit, and an ongoing champion for education, support, and transformation of nursing care here at Holland Bloorview. As a nurse practitioner colleague, she is thoughtful and reflective of how different initiatives will impact the care of children and families. She offers new perspectives and, in addition, is open and mindful of others' perspectives. In conclusion, Ritu embodies the best qualities of a strength-based advanced practice nurse. She is knowledgeable, approachable, skilled, and a respected expert and teacher mentor for colleagues and students. She collaborates with all staff and community partners to promote the best outcomes for her clients and families. Thank you for considering her for this honor.
And a revision to the agenda, Peter is reading his nomination letter.
Thank you. So, I used to think I was verbose, but it's very easy to wax eloquent about our colleagues. And in this case, I'm pleased to bring forward the name of Ritu Pruthan, our nurse practitioner here within the Holland Bloorview Kids Rehab, for your award. She's a clinician whom I believe typifies the requirements for your reward. More importantly, she embodies these characteristics on a daily basis. It is clear in working with her that her level of professionalism and compassion is the very nature of her day-to-day practice. Ritu came to Holland Bloorview Kids Rehab to work with the Brain Injury Rehab Program to specifically help work with the children with some of the most significantly challenging issues within the Brain Injury Rehab Program. These are the children that have had devastating impact on their lives from anoxic brain injury, from cerebral inflammation that has either changed their capacity to interact with the environment in a marked way, or has changed their ability to process what is going on around them in such a dramatic fashion. She has demonstrated excellence in her approach of clinical care. She has taken the lead in trying to establish a clinical pathway to serve these children and their families in a better way. She has straddled that bridge between nursing and medicine as a physician and responsible care provider for families in an environment where there has not been the norm, and she has been simultaneously learning the role herself and teaching us as in a quiet, kind, and compassionate way. She partners well with our fellow nurses. Ritu clearly sees the role of the family members and our clients as full team members and ensures that she makes time to communicate to each of them, to learn, to teach, and to plan collaboratively with the family members that she is working with. She's also begun the process of looking into research and collaboration outside of the four walls of our facility, participating in the international conferences such as the IPBIS conference, as you heard about before in Liverpool in this past September, and is trying to move the bar forward with respect to nursing-led research in the area of pediatric rehab. I know that she is an active participant in the Nursing Council here at the hospital, as well as collaborating closely with the other nurse practitioners and the ambulatory care nurses here. Personally, I truly appreciate a collaborative team member such as Ritu, who not only demonstrates her knowledge and expertise in an area, but is comfortable in stepping outside of this area to assist others in her day-to-day challenges from a clinical and educational standpoint. Sincerely, me. Thank you.
Thank you very much. And our final recipient for excellence in nursing research and in practice is Karen Gann, and I would ask that Elaine would come forward, and this time I'm reading Sean's letter.
Thank you. It's an honor to be here. Karen Gann is an exemplary nurse whose dedication and passion for nursing is impressive. In her unique position, she's been able to pioneer new roles for nursing within our organization and within the community at both the local and international levels. As a nurse, a family therapist, and a psychotherapist, Karen provides frontline support for families suffering from trauma related to their child's brain injury. Her compassionate care is highly valued by families as she helps them to cope with their recovery. And families consistently report how Karen has made a significant difference in their lives and provided them with the strength to carry on. In one case, the family member credits Karen for saving their marriage, and this actually happened at an FAC meeting where I sat at a table, and unbeknownst to me, there were 3 families who had been clients of Bert many years ago, and the first person that they wanted to speak to or know about was Karen. They asked about you right away. And I was very impressed at that moment, and I know how critical our work is with our families to the outcome of our clients, but it really made a lasting impression in their lives. Families have recognized Karen not only through many Spotlight Awards, but also have made donations to the foundation in her name. And this is remarkable work in itself, but Karen's contribution to nursing continue to inspire. She has led in the development of the Brain Injury Family Information for Adolescents, known affectionately as BFIA. This project addresses gaps around family support needs, lack of practice guidelines, and limitations in resources. It provides families with a broad curriculum of education on acquired brain injury, emotional support, and skill building. And Karen has been instrumental in developing a 2-day workshop to help clinicians learn the skills in family assessment and engagement. And in 2015, BFIA was recognized as a leading practice by Accreditation Canada. Academically, Karen has made significant contributions. And in this past year alone, you've heard about the 6 publications from Marilyn. 2 of them are co-authors of book chapters, and I think you're a lead author in one of the peer-reviewed journals. You've served as a graduate, you've served on a graduate student supervisory committee. You've participated in the Strength-Based Nursing Initiative. This underpins the nursing vision for our whole organization. Karen's presented at the Hospital for Sick Kids Neuroscience Day. She's presented at the Neurorehabilitation ABI Conference in Hamilton and at the annual Oakers Conference. And she was also asked to co-facilitate a child and youth workshop for families affected by ABI by the Brain Injury Association of Quinte District. Doesn't stop here. It just goes on. Within the Bloorview Research Institute, Karen holds the role of clinical team investigator. She is leading a Center for Leadership in Acquired Brain Injury funded project to validate the Pediatric Family Needs Questionnaire, which involves coordinating teams across 4 countries. Sweden, Lithuania, United Kingdom, and in Canada there's 2 sites, British Columbia and here in Ontario. So I think there's a 10-hour difference between BC and Lithuania. I'm not sure on that, but it's an amazing accomplishment. Karen is also involved in 2 other Center for Leadership research projects. She is developing a BFIA version to include concussion, as well as evaluating the effectiveness of Reframe, a concussion self-management program. Now we move to the international stage. Karen was a guest speaker at a pre-conference on family resilience at the first international conference on acquired brain injury, and this was a very prestigious honor for Karen. She sat on a panel with international leading experts on brain injury, and then at the conference itself, she was also a presenter, and her presentation on Pediatric Family Needs Questionnaire was ranked in the top scoring category. Karen is a caring and compassionate nurse whose efforts in this past year have exceeded all expectations. She makes a difference in the lives of our clients, families, and students, while at the same time making significant contributions in research and knowledge. Underlining all her remarkable accomplishments, Karen's passion for nursing and her commitment to the clients and families is what makes her an exceptional nurse. And it was with great pleasure that I nominate Karen Gann for this award.
I'm channeling my inner Sean Peacock at this moment, who's running one of the Center for Leadership activities as we speak. So I'll shorten somewhat Sean's words because of the repetition of these strong themes, but he spoke to your values of caring, respect, partnership, client and family-centered care, excellence, and innovation, all wrapped up in one fabulous accomplishments of excellence. He speaks to your involvement in the Center for Leadership, serving on the executive committee on 5 projects in the last 5 years, and leading projects developing the Family Needs Questionnaire, as you said, Elaine, and with the local, regional, provincial, Canadian, and international lens, which is remarkable and commendable. He describes you, Karen, as having gone above and beyond in ensuring partnership and client family-centered care at the core of your work and what drives you, and that you've brought together teams of researchers, clinicians, family leaders, student coordinators, and international partners in a way that pushed the boundaries of what we thought was possible in supporting children and families at Holland Bloorview and across the globe. Karen does all of this because of how much she respects and cares for children and families. She works tirelessly as a nurse, a researcher, and an individual and family clinician to ensure that we provide the very best care possible. And he considers it a privilege to work with you each and every day. So with that, Karen, thank you. Sean's here. We'll Photoshop Sean in later. Could all the recipients come forward? It would be lovely to have a photo with you all together. So we too, Randy. Randy, thank you for staying. I'm sure your pillow's calling. And the 10, those from earlier, please, the 10 accomplishments, please come forward. And we'll get a group photo. Fabulous. To be together. And the others? These 10 people, please come forward again. And we'll get a group photo. And I'll just get over there too. So in closing and moving on to, there's yes? No, you're not on the agenda. I'm sorry, Pam. And you know how I like my agendas. I walked in from the parking lot with these orchids this morning.
Yes, well, that was, I never see you in the parking lot. And lo and behold, who comes up behind me while I'm carrying the nice orchid? Hi.
Good morning. Good
morning.
Afternoon.
Good afternoon.
Yeah.
May I say a few words?
Yes, if you. It's a bit like the clown. She just bursts in.
Yes, sorry about that. I did ask Caitlin. She kind of had me on the agenda, but it had to be a surprise. As you see this afternoon, we have a lot to be proud of as nurses here at Holland Bloorview. And I think we would be remiss if we did not acknowledge the vision, the passion, the patience, the drive, and amazing mentorship of our Chief Nursing Executive, Marilyn Ballantyne. So all of us would like to thank you for your passion and leading us and really making us believe that we can change and bring strengths-based care forward in here and outside of the hospital as well. Thank you so much.
Thank you so much, Pam, and everyone. I just want to say a couple of things as we move towards the cake. I know I'm holding you up from the cake. But, you know, I just wanted to add, for Randy, Ritu, and Karen in particular, when I first came here, Randy was one of the first people who bravely approached me with a question and said, you know, we could do this differently. And I was so impressed by that, Randy. Ritu openly met with me in the first week and said, I really want you to come and spend some time with me, and I want feedback. And I said, actually, I'm here to learn from you. No, I want feedback. I think we'd be better together, which I think is just amazing. And Karen was one of the first people who came to my door and said, we've got to do something about improving research in nursing. Nurses have good ideas, and we need to strengthen, because it's not in our basic education, and we need to strengthen this. And I commend you, Karen, for just creating the vision and the role model for others. It's so impressive. And so these are three people who really made a huge impression on me very early on, and I'm so pleased to hear that all of your interprofessional team members feel the very same way about your massive contributions to care. So lastly, Pam, thank you for bringing the iceberg forward to our vision, and if I was a better hostess, I would have provided you with your gift earlier. Because we did bring a gift to really acknowledge your expertise and tremendous support you've provided to me over this past year and a half from afar in suggestions and strengthening my thinking. Thank you very much. And then my parting words are, be the one who nurtures and builds. Be the one who has an understanding and open heart, who looks for the best, sees the strengths, and leaves the world a better place. So with that, one last thing, Angela and Caitlin, please stand up, and I know you hate this, but Randy did it, and he's humble too. So Caitlin and Angela have countless hours of encouragement and work to make this all happen today, and to help set up the contest and the slides, and just every day I'm grateful that you're here and so helpful to all of us and all of our teams. Thank you so much. Okay, cue to the cake. Thank you so much, everybody, for coming.